Okay, welcome everybody to day one of 2020 Women's Health Week. My name is Jo Roberts and I work here at Gynaecologist Women's Health. We have a jam-packed, huge, interesting and very informative week planned for you, so we're so pleased that you're able to join us. We're going to kick off today, day one of Women's Health Week, with a chat with Dr Elizabeth Farrell, Dr Liz Farrell. She is our Medical Director and Gynaecologist here at Gynaecologist Women's Health. And we're going to talk today about vulvas and vaginas. They are things that some women confuse. They're not sure what the vulva or vagina is. I think it's one and the same thing. So we wanted to talk to Liz about that and dispel a few myths. So welcome, Liz.
Thank you, Jo. It's wonderful to be broadcasting on day one of Women's Health Week. Now, I think what's very important for us all to be aware is that our vulva and vagina are two separate parts, and our vulva are all the tissues around the entrance to our vagina, which is a tube that starts at the vulva or the introitus, the entrance, and goes up to the cervix. And that is the entrance to the uterus or the womb. And that's the womb or uterus is where the lining grows, and that's where the period comes from. So the vagina is a passage. It's a passage for us having periods. It's a passage for a baby to come through. It's a passage to have sex, intercourse. It's a very important part of our body, and it is extraordinary that it can stretch to accommodate a baby coming through. Wonderful part of our female body. Now the vulva is all of the tissues around the entrance. So it's all the hair, which has an important part to play in terms of protecting the vaginal entrance and the tissues. It's where we have the larger labia, so they're the hairy parts, the labia majora. The labia minora are the smaller lips. And then we have what's called the vestibule, which is around, that's inside the lips, and it's around where the urethra, where the bladder empties, where we wee from. Then we have the vaginal entrance, which is called the introitus. And then we have, that's at the back. And at the back, of course, we then have the perineum, which is the space between the edge of our vaginal entrance or the edge of our vulva and the anus, where of course we open our bowels from. And it's a very important part of our anatomy as well. It contains the clitoris, which of course is part of our sexual arousal and pleasure, a very important part of the female body. And it contains towards the back, it contains the Bartholin's glands, and these glands produce lubrication when we're having intercourse, when we're having sex. Also very important for providing enduring arousal, the secretions that will improve and stop discomfort and pain with intercourse, so it's not dry.
That's a fantastic and very comprehensive description of these amazing body parts. And if anybody didn't know before the difference, they certainly do now. And while we've been talking, we've been putting up diagrams as well, just to show you further the difference. But essentially, vulva, exterior, vagina, interior. So I believe that the vagina is more acidic than the rest of your body. Is that true?
Absolutely, that's correct, yes.
So why is that?
But that is during the reproductive years. So that's during the years when you're having periods, when the body is producing estrogen. It has a different pH. It has a higher pH before the periods start, in childhood and adolescence, before the periods. And then post-menopause, the pH is higher, it's less acidic. And the reason why it's acidic is that the vagina during the reproductive years under the influence of estrogen hormone, our most important hormone, provides bacteria, including lactobacilli. And these particular bacteria produce lactic acid. And the reason why they produce lactic acid is that they're protecting, the acidity is protecting the vagina, maintaining its healthiness, maintaining good bacteria in the vagina. And if the pH increases, it may be that it allows bacteria which can cause abnormal discharge or infection into the vagina. So the acidic nature, which is normal, is very important to maintain.
And how do you do that? How do you maintain?
You just let your gut be fit and healthy. You don't douche. You don't put any products, water, chemicals, anything into your vagina. The only time you would put any perhaps gels or antibiotics would be if there was an abnormal discharge and a bacterial infection, or, for example, thrush or candida infection. But the vagina cleanses itself. That's what's really important to be aware of during those reproductive years. There are...
Oh, sorry, Liz.
There are millions of bacteria in the vagina, and they're all there for a good reason.
Okay, so we were just talking about cleaning the vagina and the fact that it is self-cleaning. What about the vulva? Does the vulva need cleaning?
Well, the only reason that you would wash your vulva is that if there was any of the secretions that were sticking onto your vulval skin, we believe that you don't have to scrub your vulva. The important thing is to wash either, not to use soap, to use plain water or a soap substitute. That's not going to be an irritant, because the skin, we have to treat the vulval skin a bit like you'd treat a baby's bottom, with great respect and gentility. We don't scrub it. Scrubbing
advice.
Can actually cause the skin to be disruptive, and bacteria can grow then if it's disrupted.
That's a great message. That's a great message. Be kind to your vulva.
Exactly.
Now, you mentioned then about thrush, candida. So let's talk a little bit about vaginal discharge. Does vaginal discharge itself mean that there is something wrong?
No, it can be a natural phenomenon that occurs in individual women, just purely and simply because of the way in which the vagina cleanses itself with the bacteria, etc. And of course, it changes with the period. So sometimes women will notice that their discharge changes depending on where they are in their cycle, and also with the period. And the menstrual flow does increase the pH slightly, so it makes it less acidic, but for a shorter period of time. So, and there can be a normal discharge, and that is usually whitish, clear, and it doesn't have an abnormal odour. Now, some discharges, when there is an infection, can be different in quality. So with a thrush or candida yeast infection, it can be a bit like cottage cheese, looks white and clumpy, and it's associated with irritation. Sometimes it can be yellowish and not classically the cottage cheese. And then there's a condition called bacterial vaginosis, which is actually where the balance of the bacteria becomes abnormal, and so particular bacteria start to overgrow and come out of balance.
Okay.
So
Right.
if a woman has an abnormal discharge, which has odour and other symptoms, they should see their doctor. They should have a swab done and the doctor should examine them. Unfortunately, a lot of women with vulval or itches or irritation are just automatically told to treat themselves for thrush. And we know that not all itch is thrush. So it's very important, if you go to your doctor with those symptoms, that the doctor actually takes a look and takes a swab.
Isn't that interesting that it's quite often the case that the doctor won't ask to see the vulva either? It's not just women, but even some medical professionals. Why is it that some people find it so difficult to talk about, you know, these body parts that every woman has?
Well, women find it difficult to talk about vulvas and vaginas. If you think of all the phrases that are used for down there, or whatever words you might use, or using the vagina instead of as the vulva, etc. But many practitioners also, it depends on their culture, it depends on their what their upbringing is in terms of sexuality and their comfort in talking about genital parts, whether it be male or female. So what that means is find yourself a GP who will examine you and will make sure that you don't have any infection if you've got symptoms, or don't have any vulval conditions that are not thrush.
That's a great message. If there was one single most important message that you wanted women to take away from today, though, from watching this video, what would be the single most important message that you want people to know about vulvas and vaginas?
Love your vulva. Love your vulva and vagina. Look, every single woman has a unique body appearance, which includes the vulva and vagina. And these days, there is so much media attention on women having vulvas that look childlike, with no labia, no hair. All of these body parts have a role in how we function. So just love what you've got. And yes, sometimes it may look not what you'd like it to look like, but your vulva is unique to you, and just learn to care for it gently.
Love your vulva. That's great advice. Thank you so much, Liz, for talking.
It's my pleasure.
We've been talking with Dr Liz Farrell, gynaecologist and medical director of Gynaecologist Women's Health. She's been here talking to us on day one of Women's Health Week. Thank you so much for joining us today, Liz.
Thank you.
As ever. And join us tomorrow. Come back and see us tomorrow for day 2 of Women's Health Week, when we're going to be talking about heart health with Cherie Hughes of the Heart Foundation and one of our own Jean Hales and Women's Health Week ambassadors, Tina McCarthy, founder of the cycling group Wheel Women. So thanks a lot, and we'll see you tomorrow.